West Texas and New Mexico are experiencing an alarming health crisis. There have been more measles cases in the first 3 months of 2025 than there were all of last year. Hospitals are on high alert, and health officials are scrambling to contain the outbreak. However, there is a glimmer of hope amidst the apprehension. Vaccination rates are rising. What's driving this resurgence? And how can you protect your family? Stay with us as we break down the facts, the risks, and the critical importance of the MMR vaccine, and quat. Let's start with the numbers. According to the CDC, as of this week, Texas has reported 309 measles cases, a staggering jump from just a handful last year. Despite its smaller size, New Mexico has seen 42 cases. Tragically, both states have recorded one death each linked to measles complications. To put this in perspective, the U.S. had fewer than 100 cases nationwide in all of 2024. We're now seeing triple that in just 3 months. This isn't just a spike, it's a wildfire, and quat. Health experts warn this could be the tip of the iceberg. Measles is one of the most contagious diseases on Earth. A single infected person can spread it to up to 90% of unvaccinated close contacts. So, why is this taking place now? And quat, for those unfamiliar, measles isn't just a childhood rash. It is a deadly virus that manifests itself first as a fever, cough, and red eyes, then as a distinctive rash. Pneumonia, brain swelling, and even death are complications. Before the vaccine, measles killed 2.6 million people globally each year. Thanks to vaccines, the US declared it eliminated in 2000. But now, declining vaccination rates are opening the door for its return, and quat, measles spreads through the air, lingering for up to 2 hours after an infected person leaves a room. You don't even need direct contact. That's why outbreaks explode so quickly, especially in communities with low vaccine uptake, and quat. Amid the crisis, there's hope. CDC data shows more people are rolling up their sleeves for the MMR vaccine this year compared to 2024. In Texas, vaccinations are up 25% in outbreak zones. New Mexico reports similar trends. Because the MMR vaccine is 97% effective at preventing measles with just 2 doses, this surge is crucial. And quat, families that had previously been hesitant are now rushing to get vaccinated. Fear of the outbreak is overriding misinformation, and that's saving lives. And quat. Then why did this occur? A perfect storm of factors are to blame. First, vaccine hesitancy fueled by myths linking the MMR vaccine to autism, a claim debunked by decades of research. Second, pandemic era disruptions left many kids behind on routine shots. Third, travel. Measles was likely reintroduced by unvaccinated travelers from regions where it's still endemic, and quat, rural areas in West Texas and New Mexico are especially vulnerable due to limited healthcare access and tight-knit communities where the virus spreads rapidly, and quat, government officials are employing wartime strategies to contain the outbreak. Texas has activated emergency mobile units to vaccinate remote communities. New Mexico is offering free MMR shots at schools and libraries. Both states are contact tracing infected individuals and mandating quarantines for the unvaccinated exposed to measles, and quat. Here's what you can do. First, check your vaccine records. Adults born before 1989 may need a booster. Second, Isolate if you show symptoms. Call your doctor first to avoid exposing others. Third, talk to friends and family about vaccination. Herd immunity requires 95% coverage. We're all in this together and quat. This outbreak is a wake-up call. Vaccines absolutely save lives. If you learned something today, share this video. Check the description for CDC resources and vaccine locators, and sign up for updates. Together, we can turn the tide, and quat. Subscribe button, video thumbnails, measles myths busted, vaccines, histories. Lifesaver.